Hello, loveys. Welcome to Monday Night Lights with your friend, your best friend from out of town, if you will, Nurse Kim, talking in the third person, because tonight we have a magical show. I may have assembled the Justice League, potentially the smartest and prettiest nurses and medical professionals that I know, IRL, to come here and to discuss with us some of the not only inconsistencies in the Commonwealth's theory regarding Officer John Okeefe's injuries, but also the inconceivable theory that they have put forth. And this is on the eve of trial 2.0 starting. And what are we doing here, babes? We're here to find truth, to always be in the pursuit of justice, and we've got Karen Reeds to free. So without further ado, I would like to introduce a personal friend, someone who I consider a expert in her field. She has changed the life of many of her patients, and she is a very close friend of mine. The one, the only, Miss Jen Altman.
Hello, beautiful.
Hi, Altman.
Hi, how are you?
I am so good. A little bit
I can't believe I'm on
stinging.
Nurse Kim.
Are you kidding me? Stop it. It's me and you. We
I know.
voice
We
note
do
all
this all
day.
day, every day. Nobody can know about those.
Never. That's in like a burn pile that we talk to each other and talk all the shit at all times.
We do.
So Jen Altman, tell us about how long you have been a respiratory therapist.
I have been a respiratory therapist. I'm in my 27th year as a respiratory therapist. I've worked
Incredible.
in level 1 trauma, hospital, ICU, ERs, home care, skilled nursing, management, bedside, done it all. It's been a great career.
Well, and I just think that it's so important that we have different medical professionals that have seen it all, had the length of career that you have, and that have been able to really put your clinical judgment and what you have seen, your medical training and experience into this case, and understand where there's been deficiencies and what we know does not add up, right?
If anybody believes that John O'Keefe was hit by a 7,000-pound vehicle going 24 miles an hour, you just don't have a clue. If anybody that says that happens just has never seen it, and thank God they've never seen it, because it's not.
Yes.
It's not something that anybody wants to see. It's traumatizing, but it's not John O'Keefe.
Yes, unfortunately. And like, if it did make sense, we would be 100% in agreement with the Commonwealth. But that's not the case here.
I would never agree that it was on purpose, but I would, if there was evidence that he was hit by a car,
Yeah, absolutely. So we have another gorgeous, smart, pretty, and incredible friend of ours coming up onto the stage next. She is not only a registered nurse for the last 14 years, she is also a mother. She is an incredible moderator on the Nurse Kim, on in the house of YouTube. She lives here with us, and she has become a friend, and I am in awe of her. Her name is the one and only Cursey Nursey M.
Yay!
Hi, Lovey.
Hi. I turned the comments off, so it's just us three here. This is great. Nobody's
It's just
Perfect.
us, babe.
Yeah.
Yes.
Just chilling in the woods.
Yeah. I love that we're in a bush when we're with M, you know, like she's like, listen to me. What we're doing today is we're deep in the bushes. Okay. But we won't get caught in the weeds, and we will be able to hopefully just review some things as we're on the eve of retrial, right? We're just going to talk to each other and say what testimony, what impacted us, and you know, and just talk our way through it and hopefully make it make sense to our best friends from out of town, right?
Yeah.
Nice
Mhm.
Phelpsy there.
Oh,
Yeah.
God.
She's Phelpsy tonight.
No.
Barney.
Mm-mm.
Oh, look it. And we've got MMF saying,
Aw.
what a panel. Look at us. Who are we?
Just a random girl and Nurse Kim and Jen Altman. We're
Yes.
ready to go.
No, you're not a
No,
random
everybody
girl. Get
Percy.
Yes. No, not at all. So ladies, tell me when Kirsty Nursey M, you tell me, when did you first hear about Commonwealth v. Karen Reed? And like, did you automatically out the gate think that there was something with his with Officer John O'Keefe's injuries, or was it more for you, like the investigation, or you just had questions?
Well, I'm not a true crime follower, like at all. This is the first time I've ever watched a trial or anything. I was on Instagram and there was like a crunchy momfluencer that I follow, and she does like mom stuff and true crime stuff. So she would post these cases, and I think she had just done like it was maybe when new findings came out in the John Bonet case. And then I thought that was kind of interesting because I remember that. And then she started talking about the Karen Reed case, and I think it was a picture of his arm or something, one of his injuries. And I was like, what the hell? There's no way. And then she would post like just the important stuff every couple days, and I would just get more and more into it. So then I kind of dove deeper and found Turtle Boy and reactivated my Twitter, and here I am.
Been with us ever since.
Yes.
And for anyone who is a lovey who doesn't know the Jen Altman origin story about how you just are like an integral part, realistically, in
Not really.
No, you are though, Jen. Like, could you tell everyone, you know, not everything, but just a kind of overview of how you knew right out the gate that this was not what it had appeared to be from the Commonwealth?
Well, it really started with the House Long to Die in the Cold. That's when I kind of thought it was going to just be dropped. And then after Natalie reached out to me and I saw the autopsy photos, and I remember I saved them on my computer and I just looked at them and thought there's no way that this man was hit by a car. You know, no broken bones, nothing below the neck, even the back of the head, even the injury on the back of the head, like that doesn't come from hitting the ground.
Right.
It just does not come from, I mean, the way that it's, perfectly linear, and the depth of it, that doesn't happen. I saw a car accident once when I worked at a hospital, and it wasn't even a trauma unit. It was years ago. So it was 2001. There was an accident at Framingham State College, and it was a student, a girl, and she was driving, and it was a snowstorm, and she was driving 12 miles an hour, and she hit a telephone pole, and her passenger went through, the windshield, and he was decapitated at 12 miles an hour.
Wow.
So you're telling me at 24 miles an hour, there was no injury? There was nothing?
Right.
Unless we go by Plevin's video where he's like leaning over, picking up a wine glass and hit by a Prius with the wrong taillight.
And it was played on Court TV. So that was just,
how
get our eye
embarrassing is
twitches.
that? And he wasn't even embarrassed. Like, he
No.
liked it. He's
Right.
now a court TV expert.
Right. He's a court TV expert.
Yeah, it just didn't make sense, his injuries and what the Commonwealth was saying, and the fact that anybody can still believe that is just mind-boggling to me. You know, that they really think that. What about you, Kimmy?
Yeah. So, like, I have just, for me, it was, I always felt very poorly in the beginning, right? I remember literally, I believe, seeing on NBC 10 Boston when Karen went to her arraignment at Stoughton District Court. And I was just like, oh my gosh, how sad. Officer John O'Keefe passed away. And, she clearly didn't mean it. You could see she was all puffed, she had been crying under her mask. And I didn't think much about it afterwards, right? So then when her charges got increased, that's when I was like, oh, bitch, you were trying to like, oh, what did you do here? They must have a lot of evidence. And like, that this was a charge to the second degree, right? I go, oh, we got problems.
Right.
And then it was absolutely not the Haas long to die in cold for me. I thought that was sketches all hell, but it was his arm when Liza Little held that chalk, and I go, I'm looking and I go, wait a minute, they're alleging this happened from the vehicle. I'm thinking they were saying like it was maybe, that he fell into a bush. He was with Kersey Nursey M in the bushes, okay? Or something. I was like, I have no idea how that could have occurred. Then we find out, reading more, I started to read the filings. And when I saw what the only line that Dr. Scordi-Bello put, or that the Commonwealth included, that it was not consistent with a fight or an altercation, I said, oh, I clutched my pearls before I had them, babes. And I said,
how is it not,
Well, and never have you ever seen a medical examiner say to us what somebody did not pass away from, right? Like that is not included. That is not normal. That is abnormal in anything, any kind of documentation from an ME, from my experience.
Yeah, they're not saying like he wasn't hit, he wasn't shot, he wasn't stabbed, he wasn't this, he wasn't that.
Right.
So why would they say that? Because that they told him to say that. They said, told her to say that. Can you put something in that says he wasn't in a fight? That you don't find something in a fight.
She also said in her testimony, though, too, that he didn't present with the typical injuries of pedestrian versus a car. So, but they didn't talk about that part. When they were getting little snippets out. And that one Emmy, this is kind of random, but I remember hearing that Joseph Scott Morgan, he's a forensic pathologist, I think. He spoke today on Fox News. Did either of you guys see it?
No.
I didn't.
Dang it. I want to know what he said, but I didn't get a chance to look at it yet. Somebody tell me.
Can I interrupt you for 1 second? Can you check your texts from the other guest? Because I think she wants you to send the link to her email, but I can't do that.
Yes, I am going to try to do that. Yes, I can do that. I'm going to send it to myself in an email. Kersey Nursey M, while I'm sending an email, because I'm going to fight the desktop over this, could you tell me when you saw, basically I want to put it together of like the culmination or all of the injuries, right? Because the lack of bruising or the bruising where it was, i.e. on the dorsum of his hand, and then he had a also right knee bruise. But there are some people, her name might be Kate Peter, made a recent video yesterday that said that all of Officer John O'Keefe's injuries were to the right side, and that is consistent with a motor vehicle strike or a pedestrian strike, if you will. And That's why you should leave it to the professionals, because he had an intraosseous line placed. And that's why it was two. Go. You tell me more about the intraosseous, Kersey Nursey M.
Yes.
He had 2 of them, one in each tibia. And he had bruises, I think, one on each hand, the left and the right hand. And Scordi-Bello said in her testimony that it could have been from IV placement.
Yeah.
We lose Nurse Kim.
No, she's sending it. She's sending the other
But
stuff.
I don't think there's any way that that could have been from an IV placement. I think she thought that. She said there were 2 like pinpoint marks
Right here
in the bruise. Right. But when you're hypothermic and you're probably very dehydrated and bleeding, I mean, he lost a lot of blood. There's no way they would think, oh, let's try to get a line in him. And especially in the hand,
Never.
if anywhere you would try like the antecubital. I don't know. That just was crazy to me that she said that, because being a physician, she should know that that's like probably didn't happen.
And they testified to that. The EMTs testified
Yeah,
to
they
that,
did.
that they placed the IV in his tibia.
Yes.
And not in, I mean, did you guys hear them say that they first attempted the hands, or
no, I don't even think they would,
because they were trying to warm him up too. So they went that way.
Yeah. So that goes right into your bone. They use like a drill. It goes right into your bone. And I think the fluids go through your bone marrow. It's a straight shot. You can't really miss the tibia. If you do, then I don't know, you might be in the wrong field. Just saying.
You know, with the broken bones.
Well, and they were so advanced.
Yeah.
They had a CPR.
No, I was just saying that they were
It must have been ACLS or something.
Yeah.
Mm-hmm. I can't do it.
Kim, if you can text it
I'm
to
lost.
me, I'll send it.
I don't know how to send
it.
I
can't. I don't know how to text it, because it lives in the oh, guys, I'm lost. Okay, hold on. I'm going to try to email it to. Can you hear me?
I copy and paste it. Can you do that?
Ooh. Did I leave? Okay, there.
Compose. Okay, then here it is. So I'm going to go legal nurse. Sorry, guys. I'm working on this. I'm going to get there. I'm just going to put this, and then I've got to add that, and then I'm going to send it. Am I sending it?
Yeah.
Sending it.
Karen, yeah. Flamati was the one that went through it all and said that. And, you know, when you have an EMT saying one thing, or a paramedic, and then the doctor saying something else, who are you going to believe?
Yeah.
You know?
Yeah. And he also, though, let's be perfectly clear. There was, you wouldn't be using a hand, right? You're never going to you're never putting a line into a hand, because the vein wouldn't be able to take the fluids that were needed for resuscitation. So they had to warm him. They were doing all sorts of advanced resuscitation for Officer John O'Keefe, because his temperature was 80 degrees. Now, I want to ask this question to all of you. With regards to a hypothermic patient, have you ever seen a hypothermic patient come in that had allegedly been out for over 6 hours in between 18 and 22 degrees? Okay. This is what the Commonwealth wants us to believe. How did he only have, and Anthony Flamati did testify to this, that he had the beginning stages of frostbite, okay, to the tips of his fingers, but didn't mention his nose, didn't mention his ears. He had no protective gear on, right? He didn't have his earmuffs, his mittens. He didn't have a scarf. He didn't have a friggin' coat, okay? Nothing. And you're going to tell me that he didn't have severe or, extensive frostbite from being out in the lawn that long? Thoughts?
There's no way. There's no way it didn't start. I mean, he had the baseball cap on, so his ears are showing. Yep. His nose, so maybe his fingertips a little bit, but it would have been so much more extensive had he been out there. Maybe it was indicative of him being out there for 3 hours. It just doesn't make any sense. He would have had some lividity. He would
Oh.
not be alive. It just doesn't make any sense that he was out there for 6 hours, 5.5 hours, something like that.
There's no way. Did the EMTs take his temperature? Did they ever say that? I only know that 80.1 from
hospital. Yeah, it was at the hospital.
Yeah, Good Sam. They didn't. I didn't recall from testimony getting a temperature from either Flammati or Nuttall. Granted, both of these men, and I can't remember. God forgive me, but I didn't go over Katie McLaughlin's testimony for her paramedic abilities. I went over it for other reasons. But Flammati and Nuttall, very educated. Okay, educated kings. Saying that Officer John O'Keefe was pliable, right? Like saying that he is moving, that you're moving his arms and his legs, and that he is a viable candidate for CPR was wild to me. Okay.
Right.
Because anybody, all of us, we can sit back and think to ourselves, yes, definitely. If there was someone who was out there for maybe 2 hours, have we seen children fall into ponds, right? You know what I mean? Or something, and there's miracles that happen. But this specific storm, the wind howling, the temperatures below 32 degrees, for him to present the way he did has never made sense. That at 12:30, anywhere near that time, that these injuries he sustained, in my opinion.
And the fact that when I think Flammati is the one who said it exactly, Ruby, I was just going to say that he vomited during intubation. So there was something there. And so, Frankie.
Oh, come on.
So,
I can't see her yet.
Oh, you can't see her?
She's here.
I'm here, I promise. I'm sorry. I'm here. F up. I don't know if I can swear on this professional channel, Kim.
You most certainly can. Drop the F-bombs, Francis Mary.
Oh, they'll be coming.
Uncle Frank.
Did I miss the burr holes yet? That's all I need to know.
No,
we did not get into burr holes.
Christ. Okay. I'm sorry. Continue, professional.
But the vomit thing, and I said this to Kim the other day, that this has always kind of confused me because, could he have vomited during a head injury? Probably, yes. Most definitely he probably did. But where they found it on his boxer shorts, on the elastic, and the fact that he vomited during intubation makes me feel like they were like suctioning him out with a gang cower and threw it, on the floor, and maybe some vomit got on his shorts. But the vomiting during intubation is huge to me.
They didn't get much out of him too.
No.
I think he had like 50 mLs, which is not a lot at all. And that's in his stomach. Like after they got the ET tube in, that's how much they got out. This wasn't like his mouth suction.
Yeah.
So I don't, you guys know, I don't know much of anything. Sorry. I don't know much of anything about the trial and everything. So my question is, they were all drinking. Did he vomit beforehand at all? Do they know that? Like, was he already vomiting from like throwing them back? And maybe that's how some got somewhere else. Like, was there vomit on him when they got to the scene? Like, that's something I don't know.
They've just found it on his box. It wasn't on his shirt. Well, as far as we heard, who knows? It wasn't on his shirt. It wasn't on or his hoodie. I think the only place they found it was on the elastic of his boxer shorts.
And he was in the clothes that he was in at the waterfall and everything when they found him. He was not in any different clothing. He wasn't changed.
Correct.
Okay. Interesting.
Right.
Yeah.
And I don't believe that they took off his clothes and washed them and then
no, they were doing laundry service.
I'm telling you, that was a
saving a life
for a while that they washed his clothes and put them back on and put a puffy coat on him.
So well, let me just introduce Uncle Frank. For anyone who does not know, Uncle Frank is our best uncle, our favorite uncle, and related potentially to our Auntie Deborah. And this is a registered nurse who is an ICU trained. Okay, you want to talk about a bitch who knows her way around trauma. That is our girl, Frances Marion, first of her name. Only refer to her as that from now on. And Frank has gone through a lot lately. Okay, hasn't just had the best, she's been trying to free Karen Reeds, but she's also trying to free her kidney. Okay. And you're as beautiful as the day is long. And I thank you so much for taking your time to join tonight. Cause I know you're not feeling, I want you to get better every single day, but we love you. We're praying for you. And, babes, I'm going to put in this afterwards, like as soon as we get off, because I can't do it right now because I don't know how. But there is a little something if you would like to help your Uncle Frank,
oh my gosh,
help and get her where she needs to go, because she's done a lot for a lot of patients, for a lot of family members, and she has been an angel face on this earth and deserves all the help to get her where she needs to go so that she can continue to be a ray of light.
Thank you so much, Kimmy.
I love you.
I love Uncle Frank so much.
Of course we do.
Thank you so much.
So Frank, I want you to tell me from an ICU standpoint, when you saw Officer John Okeefe's, I know that you know about his laceration to the right occiput of his skull. It was told that it was catastrophic damage to his brain by Renee Stonebridge, who was our neuropathologist. And we know that Dr. Scordi-Bello said it could be. What, if anything, could it not be? Okay. She was saying it could be, A, it could be B, it could be a zebra, it could be a donkey on a Tuesday. She said anything could have happened here, right? Because she's trying to move herself and kind of do a little bit of a shuffle with not putting herself in a box, right? And not trying to frig the Commonwealth or the defense. Okay. But have you ever seen someone that has come in from a horrifying, MVA, motor vehicle accident is what we call it, loveys. It's an MVA for short. Have you seen anyone with a perfectly linear horizontal 2.5-inch laceration to one side of their head that they fell allegedly on ground?
No. What?
Yeah.
So if you want a nice, properly placed one side and you're trying to say it's a motor vehicle, no, that's not what happens. The vehicle doesn't just pick this one little particular area. You're going to get a laceration from a hit. You're going to get a laceration from impact. You're not going to get a laceration from a Lexus backing up at 24 miles per hour. Also with snow. So we're all talking about snow. So the car also has to drive through snow. So that speed's not going to be 24. That impact's not going to be as hard as they're all saying it is, because you're not factoring in the snow, but you're factoring it in when you want to.
Yeah.
So, no, that's not, no. No.
In reverse too.
Yeah, that's no.
Drunk.
You're not serious. That's not
I
making it.
7 in reverse yesterday. And that
That's terrifying.
so fast. Like everybody always says that, but it's true. I feel like
You can't do it.
No,
You can't do it. And the fact that they said that, he hit his arm. There's absolutely no way. I mean, take away the injuries, the dog bites, the abrasions, the lacerations, whatever they want to call them. His arm would have been shattered if it had been hit by a car.
Did
Absolutely
he just stand
shattered.
there and wait for Karen? He was just standing there like, here she comes.
Yeah. And how loud it would have been.
Right.
That car hitting 225 pounds was he or something?
17, but yeah, close enough.
17-pound man.
17, yeah.
Yeah.
Yeah,
Someone in
Frank,
the
tell
chat
me about
just said-
burr holes.
Hmm?
Oh, sorry.
Someone in the chat just said something interesting. I just saw pop up that said, "You're not dead till you're warm and dead," and that's the absolute truth.
Yeah.
So the burrow hole thing. Can I first ask who said somebody should do burr holes at the site? Who was saying?
Brennan.
Brennan, bitch. I lost my mind. I know.
This
Who
has
was
me
he saying that should be performing these?
I don't think he said at the site. I think he just alluded to, well, go ahead. I'll say my opinion after yours. I think he meant just in general as a treatment.
Right. That if he had gotten there earlier, say it happened at 12:30 and she had got him then, that they could have drilled holes in his brain and relieved all the pressure.
Yeah, that was the blame on Karen, right? So that's why it was second degree, because she had left the scene, and had she had turned around and got him allegedly like treatment, the burr holes, okay? That was what Hank Brennan was betting on. He's betting on burr holes, babe. I said, oh.
Does he have a doctor who's going to say that? Who actually saw John?
The neurosurgeon who does the gamma knife radiation treatments. Right.
He has no idea what condition he was in, what the condition of his brain injury was, what the pressure in his skull was, whether they could have relieved it.
Yeah, like we're not Monday morning quarterbacking what was happening in an acute trauma response, right? Here's the thing is we don't do that in medicine. You don't go like, yes, we do, postmortems and stuff. And we'll have to say like, like for the team, but there's no turning back the hands of time unless there was, something that was 100% notable of a team member who was there, right? This guy is coming in and saying, well, I'd like to hypothesize, right? Because it is ballsy and a hypothesis to say, if Karen, if this, then this, but you don't know what the variable is. You don't have the X, bitch. So you can't ever find it. You will never be able to get there because he doesn't have any of the findings that were used by, I guess, Justin Rice, because he didn't remember shit about shit. That was our ER doc at Good Sam, right? Like he didn't know anything. He was like, oh shit, I didn't even know it was my patient. Yeah. Right?
He didn't even write anything down.
No.
He said he wrote it down and then they presented him his notes and he didn't write it down, or he did write something down that he said he didn't write down.
So when we're saying burr holes, is he saying like, Officer John Okeefe's intracranial pressure was this. So if we did this, it would have helped. Do we have that? Like, is he saying that? Do we know
said
those
that
things?
He would have lived. He said
Does he even know the intracranial pressure that he had, where this would have been the, saving grace?
No, babe.
No.
And also, I do want to remind everybody, and this is a little bit jarring. All right, so get ready to clutch your pearls, everyone in the chat. It wasn't actually documented, right? That even the laceration wasn't documented by the EMTs. They didn't even note it. So, okay, all right. So in the field, they're fucking trying. They get it. They get an intraosseous, right? After 2 attempts. Thank you, Kirsty Nurse M. I thought it was only 1, but 2 attempts. They get it. They're
2 lines.
Oh, 2 lines. Thank you.
Sorry.
They are trying to warm him. He's hypothermic. They're going through all this shit. But you're gonna fucking tell me that you didn't see what was part of his cause of death? They didn't note in the paramedic notes the 2.5-inch laceration to the back of his cranium. That's scary. Okay. So, and also, was he not, there's a little bit of a question of what were you assessing, or how were you able to, assess, I know the viability from him being pliable and him, not him still having, redness to his back, right? They were reporting that, not like pooling of blood, guys. That's what you're looking for, of saying like, oh gosh, are we going to pronounce this, or are we going to try? Because the cops could have pronounced, right? If he had more than 3 signs of death, they could have pronounced him. He didn't have them, allegedly, per Flammati and Nuttall. So, they're working on him, and I know it's all in such a rapid pace, but either they didn't document it or they didn't note it at all, and that's scary because was he not bleeding? Because if he's on the stretcher, right, he's in the ambulance, they're working on him. If they were getting all of his fluids, right, they are suctioning him, they are doing high quality CPR with a machine, and you're not seeing what happened at the back of that fucking skull.
And you're not focused on it. If the EMTs aren't writing that in their report, that's not where your focus is. And like, okay, the cops aren't allowed to pronounce, so it would have had to have been a doctor, but like, they could say like DOA or something, and then the doctor would pronounce it. But like, if you're not focused on that head injury because you don't know it exists, you're looking everywhere else, and then you're wasting time. That's what's happening.
And when Karen said on the documentary, and I called you about this, Kim, that he had the glass in his face, and she flicked the glass off his face and blood came pouring out, he wasn't dead.
Actively bleeding. Yeah.
He's actively bleeding. He's not dead.
Yeah.
Yeah. Just wild. The whole entire scenario that the Commonwealth would like us to believe is just bananas. I do also want to give you a quick fast fact. Statistics, babes, is 98% of people, or 95% of people, I lied, being struck at 25 miles an hour live. Okay. Never mind being struck, sideswiped. Okay. This isn't even a direct hit. You're telling me that the brunt of the impact occurred to Officer John Okeefe's right upper extremity. That's it. What the fuck? What?
Sense. Yeah.
This case is so crazy.
And Uncle Frank is just kind of learning it now, which is so much fun because you tell her shit and she's like, what?
Yeah.
What? No. What?
Blows my mind. This is blowing my mind. The medical piece of this is blowing my goddamn mind.
His brain injury was so extensive. Like, first off, he had the subarachnoid hemorrhage, but he had it on the left temporal pole, the frontal poles, the left lateral fissure, right temporal lobe. I mean, it went everywhere. And eventually the swelling compressed his brainstem. So I think that's where the neurosurgeon is getting the burr holes. Like, if we would have prevented that swelling from happening and the blood from filling that area, then maybe he could have been saved. But say like, okay, that even happened, his quality of life would have probably been nothing. He would have probably been like vent dependent, maybe, never even coming off ever probably. And I don't know, that was ridiculous.
Did anybody like on the scene, were we checking pupils? Were they blown? Was one bigger than the other? Like, I have so many questions that probably aren't answered in the trial. I don't know, maybe they are, but like, are we checking pupils on scene?
They weren't. I don't think that was asked.
I don't think they could. His eyes were so swollen.
His eyes were really swollen.
I don't even know if they could have gotten them open enough. They were.
Oh, Kino.
I mean, to see your pupils, you just need a little bit to see if they're blown. Like, that should be a question. Like, were they already blown on site? Like,
I feel like they said he was fixed at 5. I really do, actually.
Yeah, that kind of does.
What? Then I'm sorry. You're all respect to him, but fixed at 5. You're kind of What are the burr holes going to do?
Nothing.
Yeah.
Thank you. That just bothers me. The burr holes really get me. I can't.
I know, especially by a neurosurgeon from Florida that does like gamma knife.
Oh, he's from Florida. Okay, then what?
Makes sense.
Like targeted radiation to shrink brain tumors. Like, has he even ever done trauma surgeries? We don't know.
Yeah, that's a whole different ball game, and he's the expert they went with. And that, never mind. I'm not asking questions.
Well, and Judge Cannoni, of course, let it in. Do you know what I mean? So that's just egregious.
Well, is he single? Did she have a heart on? Like, those are other questions. Like, is that why? Like, what are we doing here? Fuck's sake.
Yeah.
Maybe. No, he's married.
Oh, she don't care.
Kim's being taken down by Keno.
Any port in the storm.
Oh, yeah. Oh, speaking of storms and ports, you know, it has never made sense to me, also just evidence-wise, ladies, about how they only found allegedly a couple of droplets, like, you know, the blood that they were putting in the red Solo cups, right? You know, it's just odd. Like, why were there these drops if you're not seeing a larger pool of blood, right? Like, how
Your
were
head
drops
bleeds more than
Yeah.
anything. Anything. You could get a small little scrape on your head and it is gushing blood.
Do you know how hard your skull is too?
So hard.
So hard.
That's what she said.
Some people are extra thick too, you know?
What?
Some people have extra thick ones too, you know?
Oh yeah.
We get to read that all day.
And he had a hat
on.
on. So how hard?
Right.
And then for the doctor to say, was it Scordi-Bello that said that injury couldn't have come from a weight bench or a baseball bat or I think 95% of the people would say that it would come from something like that, not from hitting the back of your head by falling.
What is it that wasn't Hank said? He said something recently that
I hate it here. This is terrible.
What did he say? He said something couldn't have come from. I know what you're talking about. It was Hank though, and he said it recently in court. Oh, that's gonna drive me crazy.
No, Dr. Scordi-Bello was actually not hurtful to was not hurtful to Karen. And I do want to get all of our opinions on, you know, it's huge that one win for the defense was that Judge Cannoni denied the Commonwealth, right? And is allowing the admission of the undetermined manner of death. And, you know, like, no one in the Commonwealth, I do not know of any case that I've ever seen, and I love true crime, that a homicide is being alleged that was not determined a homicide and a manner of death. You have blunt force trauma. Yeah,
I don't know if Frank knows that. Frank, the cause of death on the death certificate is undetermined. It's not homicide.
So how are we even having a second trial? How did we have a first one? And how are we now having fucking part 2?
That's what
I know,
we
babe.
To know.
What happened?
I know.
In Canton? I don't live that far. Most of us don't live that far from there. What the fuck happens there?
I don't know, babe.
Don't go there.
For what?
They call murder suicide with Sandra Birchmore. They call John undetermined and then bring somebody up on murder charges when they don't even classify as homicide. It doesn't make any sense.
Oh my God. All this should be done too. You ask people questions, you'll get charged with felonies. It's a whole mess there.
And I did this demonstration the other day, babes, but I'm going to do it again just because I like it. So if you put, like, I have a mouse pad, right? And this amount of your cranium, of your skull, would have approximately, for a lady, for me, for my big fat head, this is how much of my skull would have made contact with the ground. Okay. And this that's a big old bitch. She's a big old bitch, right? But if this would have if I were to pirouette and then go down, right, allegedly, then that is the amount of, like, how much, because all right, we got a little bit of a curve in it, right? Like, you got a little bit of a bend, and that would have well, maybe not all that much, but that much would have probably touched. But why would it only have been a 2.5 inch laceration? There was no boulder, there was no rock, there was no, other thing that allegedly Officer John O'Keefe struck his head on, like a projectile, something that had to be there to create that linear fucking laceration. It does not make sense. It never will. The murder ground did not get you. You know what I'm saying? Like, this is like, we've got a vehicle that bites. We've got a murder ground. This is just like, I live on another planet. I do spin on the rings of Saturn regularly due to this case. And I think to myself, like, when I hear Commonwealth supporters be like, that makes sense. You know, like, this all makes sense. And you're a dumb bitch who doesn't know shit. And I'm like, I have been a nurse for almost 18 years now. I am a nationally wound certified R-fucking-N. I also am a legal nurse consultant. I'm going to need you to absolutely shut the fuck up when you want to talk and you don't have a clue, right? You know what I mean? Like, oh, it all makes sense. I'm like, you people are unwell, okay? Because it does not add up. And I do not believe that anyone, any nurse, any doctor, any nurse practitioner, any LPN, any respiratory therapist, a PT, OT, anyone I have spoken to in the Commonwealth of Massachusetts and beyond has never said to me, yeah, Kim, makes sense. Like, I really am behind the Commonwealth, right?
That's car versus pedestrian. No question.
No.
It doesn't happen. It doesn't happen. Nobody thinks that. Now, and if he had been hit full force or even bump, there would have been blood. There would have been tissue. Some of them say she ran him over. Where's it underneath?
She ran him over with those injuries. She ran him over.
No, some people say she did.
Oh,
he ran over his foot, but his foot wasn't broken. He ran over it. Like, the things that they think of to put Karen Reed in jail or make her guilty are astonishing to me.
Truth.
And there's no evidence whatsoever. There's nothing on the car. So there's a little touch DNA on the taillight.
Which what we know that cops touch the back of cars when they walk behind them. Not only that is like ingrained in them. My dad does it. Like, old school cops even do that. It is not unusual.
He could have helped her take the grocery in 3 days before and,
of course,
lifted it and put his hands or whatever. I mean, he could have brushed by it. It's so easy to transfer.
But they were dating, so like, he's touching her car.
Right.
Nothing.
No blood, no tissue, nothing.
That's another big point that they need to really harp on, I think, is that only DNA, it was just touch DNA. There was no blood anywhere on her car. Nowhere.
You know, and that's something that the Commonwealth supporters will like push back with us and say that, well, they didn't say it was touch DNA. Well, babe, there's how many types is there? Okay. Like, come on, we got to do process of elimination here. You know, like, what are you alleging it was? If it was not blood, it's not a bodily fluid. Like, what, you know, like, what is it? If you're claiming that it is something that was nefarious or something that shows or points in the direction of Karen Reed's guilt.
If there was any part of the tail, they're saying that, so what? She hit him and then he waited there with his arm while this taillight broke, right? And then scratched him. On one of those 47 pieces of taillight, there would have been blood.
Right.
There would have been tissue.
Yeah.
There would have been epithelial. There would have been anything. Did they test it? Did they test all 47 pieces?
No.
Guys, does the other side?
Oh, she didn't.
I don't know what we're calling it. The AK, whatever it's called. Do they have medical professionals on their side that are saying, like, yes, this is totally 100% plausible and true and factual, and like,
we don't know
going and sitting in the cottage and being like, yeah, like, I'm an actual professional with a license and this definitely makes sense. Like, do they have people doing that?
Yes. They have 2 that I know of. And I fought for my life in the cottage one night. Okay. We all remember that.
Stay out of that cottage. Stay out of the sticky floor cottage. I can't stress it enough.
Sticky floor cottage.
Can't.
Yeah. I fought 71 71 rocket scientists. And you know, it was wild. But I do know, like, and of course, you know, whatevs, but there's two, and they believe it. They believe it. And those are the only two people I know.
Doctors
if they
are
work around here, I don't want to go where they are working. No.
Agreed.
I don't want that.
Totally agreed. Now, is there anything else that you guys specifically were thinking to yourselves, like, that this has never kind of made sense to you, medically speaking, from Officer John Okeefe's injury point of view? Because my only other takeaway that I've had is that when the Commonwealth supporters want to tell us that Karen Reed is guilty because of what she said, right, babes? Like, and what she said in the new ID docuseries, where she said, I was thinking to myself, I wondered, you know, could I have hit him? Did I hit him? Potentially, did I run his foot over, or did I clip him at the knee? Well, I am firmly here to tell you that Officer John Okeefe's autopsy and his body and the medical professionals let us know that no matter what Karen said, he tells us that it did not happen. His body told us that no matter what she said, the science, the anatomy and physiology, and an autopsy proved that it did not occur. So because he didn't have a scratch on his foot, he didn't have a broken foot, he didn't have a broken toe, he didn't have not one scratch on his lower extremity other than where the intraosseous was put in, where in his tibia. Okay, so that is clearly indicated and marked from that, you know, from that intervention. It had nothing to do with Karen or striking him or clipping him at a knee.
Did they go for an IO in like the upper extremity? Just like a question I don't know the answer to. I don't know why they like IOs are great, but tibia, that's going to take the medication that you need to sustain life so long to circulate to the heart if you know anything is circulating.
Yeah, I don't think they tried anywhere else.
Oh, that's cool.
Oh, am I froze? Ooh.
I think we're all freezing, right? You know. Oh, Kirsty Nurse, yeah, you are. Oh, you're back. You're back, babe. Don't worry.
Oh my God, that was funny. No, it's probably my Wi-Fi. You're good.
Is there anything that you think, Kirsty Nurse,
I just all of a sudden Hank started saying coup-contrecoup. I never say it right. But when was it ever classified as that kind of injury? Like that means where the injury is, you have injury, and then the opposite side, you have injury. So you have two injuries. But John's he had the origin back here, and then he had, you know, up here, but also the sides and then inside. So it was basically everywhere. So this whole calling it a coup-contrecoup injury to me is kind of misleading. And also not one person called it that in the first trial.
Right.
Nobody. And then Hank comes out.
Who taught him that word? Somebody like taught him that word and it stuck and he decided to use it because it's not.
That was his spicy neurosurgeon, babe. That was the spicy
Supposedly.
Floridian.
Oh, yep. Back in Florida, for fuck's sake. Oh.
Andy was saying,
but I think it does make sense because you can, from like even from a fight or from anything. Like, I mean, I think it would make sense with a contrecoup injury, in my opinion, just from anything that I've seen, because that would make sense to me. But for him saying it the way that he is, he's trying to allude that. Like, I think that if we had a specialist get up and say, absolutely, like, yeah, that is indicated like by A, B, and C, but it wasn't documented anywhere. Could you say it's a theory? Sure. But as for a documented, you know, finding, no, it wasn't there.
But it makes more sense that if he hit the ground, then it wouldn't be that type of injury because of gravity.
Of course.
You know, but if he got hit on the back of the head while he was standing up, then it's the forward motion, which would cause the damage in the front of the brain.
Right.
But if you're hitting
Oh, I get what you're
backwards,
saying. Yeah.
then you're thinking about gravity hitting back. It's not. Does that make sense? It's
Yes.
not
Yeah,
like
it does, because it's only the
Trying to
one, you're
apply
only
it
going
to
in one direction, and he wouldn't
Right.
have had the jolting back and forth. And if he was hit
Exactly.
from behind with what I call the
Then he
fatal
would.
blow, then that is
He
what would have made
Right.
his brain do a little jiggly pops.
Exactly.
It's a good
Yeah.
point,
Exactly.
Altman.
him using that term,
Not bad
saying
for a
that
respiratory therapist.
injury
though.
he
Not
got
bad.
from the car hitting him is just doesn't make, it's not helping him saying that, you know, for that theory. It doesn't make any sense.
He just came out swinging with coup-contrecoup and burr holes all of a sudden, and nobody's ever said any of those.
The burr holes really really chat my ass. I hate it.
He
so
hasn't said that since that first hearing, though.
Yeah, he tried that one time. He
stupid.
put that on for size, and he said, "I'm going to take that off. I'm taking it
Yeah.
off. I'm sticking to my
He's like,
pencils."
I'm
You know?
actually
Yeah, scratch
stupid.
that.
Let me get the white out. I'm stupid. Christ.
Yeah, that doesn't.
And
make
also
any
the other
sense.
thing I did want to like ask you guys of your opinion, because smart and pretty, Frank, for you to say about did he vomit while like, okay, we're understanding for the vomit in his boxers elastic, but I want to go back, babes, to remember that Officer John O'Keefe's blood alcohol content post-mortem, okay, via his vitreous
High.
humor was fucking 0.32, I believe. Somebody correct me in the
Oh,
chat.
I got it written
Chat.
down. Hold on.
Oh,
Hold,
there we
please.
go. Cursing our CM is going to hit it.
I've got notes.
I got my notes. I think it was 0.21. It might take me a
Oh,
minute.
well, I know that I
Yeah,
thought that it
0.21.
was 0.28, or what was it, honey?
What
did you say?
0.28 was in the vitreous humor and his
Post-mortem.
toxicology. Yeah. And then
Post-mortem.
So hours.
wild.
Hours.
Hours. And you
okay.
you go
Now,
through a certain amount every hour.
of course. Yep. For your metabolism. But
So
here
he
was
must-
my concern. So then if he was over 0.3, which he was, okay, he was when he was alive, right?
Way over.
You know, you're at risk for going into, you know, acute alcohol poisoning. Like he could have been, you know, I mean, there are so many different things that could happen once your body reaches 0.3. And I'm going to actually Google it because I know that there is specific, you know, that like your like you have things that are no longer, I mean, listen, when you're buzzed, you have things that are like, hey, I'm a little foggy, cold Medina. But with him being at that level.
But Kimbo Slice, does your body still process that after you're dead? But their claim, he wasn't dead when they found him. He wasn't dead. So he was processing that alcohol, what they say, for 5.5 hours out in the snow. And then his level was still that high when he got to the hospital and was pronounced. That's a really high BAC.
So, okay, here it is. A 0.30 blood alcohol BAC is dangerous level, potentially leading to alcohol poisoning, loss of consciousness, and even death, requiring immediate medical attention based on his fucking BAC alone.
Yep.
Oh. All right. Now we're going to look at his pancreas, and we know that he had hemorrhaging in his pancreas. Okay.
From hypothermia.
I'm just saying.
I mean, the hemorrhaging in the pancreas could also been from the alcohol. Like your body can't process that. It's going to start to, your pancreas, your liver, they're going to start to shut down. Which could have been
like, and who am I? Who am I? Because she attributed it, Scordi-Bello attributed it to hypothermia, right? Which I get, but also could it have been also in conjunction with acute alcohol poisoning?
Wisniewski spots. That's what they were called. Something like that.
If they're big drinkers, has he always been drinking? Was his liver already not working well? Was his pancreas always kind of like getting to be like kind of shitty? No offense to him. I know he's dead. I'm not trying to talk shit, but like if you've been a drinker, these things aren't going to process your alcohol as well anymore or process anything as well anymore.
With your sluggish, you could have had a fatty liver or like, you know, cirrhosis, God, you know, and God forgive me, but like,
I'm not
you know,
trying to
there is
kill them,
a lot of questions, right? We have variables there, But again, even somebody who is a daily drinker, there is when you are getting to those levels, you know, this is not something, in my opinion, that is to be shrugged off at all. And I think that needs to be a little bit just like explored, because there is a persecution and a crucifixion on Karen Reed, right? With regards to her blood alcohol content that was taken at Good Samaritan Hospital at 9:00 in the morning on January 29th. They assumed that she stopped drinking at 12 o'clock, which I've never thought she has. I've never talked to her about it. Couldn't tell you shit. But if my boyfriend was out, okay, and I thought he was maybe, playing hide the salam, damn right well, I would have had a nightcap or two. Okay. And if I fell asleep and woke up and, I would have, been cursing at them and also saying, sipping a little bit, So that was an incorrect extrapolation when they were pulling it back. And it wouldn't have also been introduced into court because she was there for a freaking Section 12. She was not detained. She was not arrested. She had no other reason to be at Good Sam other than she dropped her basket and was there on a Section 12. So they used this against her, and you're going to say that for her at the legal limit, at the driving legal limit, right? That she's there for a DUI and charging her with the manslaughter. But then if we really are taking a look and saying the amount of alcohol that was consumed by we have two individuals, right? We have Officer John Okeefe's postmortem levels, and we have Karen's morning levels.
What was her
just
morning
saying?
level?
It was 0.09 at 8 a.m. or whenever they took it. So they did an extrapolation and converted it that it was 0.16 or something.
A total gap.
0.13 to 0.29.
Yeah, it was like such a big space.
And you think of that from any of us or any of our patients, right? Even going into the hospital, guys, you have a specific fucking time frame. You know what I'm saying?
Right.
Like they're taking it to make sure that they're just doing a full panel on her. They're doing a talk screen, whole nine. She came back negative for all drugs, whatevs. And they're just doing that so that they can just have a base. They just needed to know it wasn't for treatment, which is why I was hoping it would have got kicked. It would have been, suppressed. But the fact of the matter remains, I don't believe that Karen was in the position to consent to anything that morning. She fucking dropped her basket.
And I think she didn't consent at first, right? She didn't consent, and then she gave her consent. She was talked into it.
Yeah.
But how can they use a next day blood alcohol level for anything in court? I don't it wasn't taken, within the hour or so after the accident.
Wasn't at the scene.
Whatever happened.
They didn't do it.
I don't understand.
They didn't do a breath test. They didn't do anything.
And it wasn't done the correct serum either. Yeah.
Wasn't one of the factors a complete guess? Like they had to guess what her highest alcohol level was or something.
Yeah, it was 0.29.
Yeah.
We have to guess in a trial for someone going to jail for life. We have to guess. Oh my God.
Right. And back on the John's BAC point real quick is that affects your body temperature regulation too. So
oh yeah.
You know what I mean? They could have only been out there for 30 minutes and his temp dropped really fast because of all the alcohol in his system.
Well, yeah, and then as soon as you have a trauma, your blood supply is going to go to your major organs. It's not going to, we're not going to get an IV in the hand. We're not going to get an IV in the foot. We're not going to be warming up our iPhone with our body because that's super important, which some idiot online said. I think it was good time. I don't know. It's just,
they all say
I can't fucking stand it.
Yeah.
They
Right.
all say it.
God.
Right.
Whoa.
I just will never, I will never be okay or get to a point where, like, even if there wasn't fractures, even if there wasn't lacerations to his lower extremities, there had to have been like there needed to be bruising, significant bruising. And or if you're alleging that he only struck his arm, then mathematically, physically, emotionally, and fucking spiritually, there is no way that unless Officer John O'Keefe was a bionic fucking man, he did not break a polycarbonate taillight with his arm. It didn't happen.
It
It
didn't
didn't.
happen. It just
You know?
didn't. We'll take that from Trooper Paul. It just didn't.
It
Have
didn't.
you seen that guy's new YouTube channel? It's like Be in Trouble or something. And he's been doing all the taillight experiments. He bought a real
Oh, I love him.
Lexus.
Mhm.
Yeah, you know who I'm talking about?
Yes.
I thought that was interesting because it shows.
It took him 14 hits with he did like this like reinforced like he recreated our arm, guys, right? And he got a 2021 Lexus taillight and he smashed that bitch, okay? Like it took him 14 times he got a crack in it after like 4, right? But then it was like it ended up like part of the compartment actually broke and hung off on the 14th one. And he was like, there is no way this happened with one strike at 24 miles an hour, because he with the steel beam and the he made it so that it would be like an 11-pound arm or some shit. But or 17, I don't know what it was, but he did it so many times at the most that he could for the most impact. And it is impossible to have that occur with that vehicle. And I know because listen, I didn't have a Lexus LX, but I had a 2018 Lexus RX and I hit a pole. Okay. What? A telephone pole. And I backed into it at a whopping, I don't know, 5 miles an hour, 3 miles an hour. It was in a blind spot, bitch. I didn't see it. Okay. So I'm backing out. I'm at like a consignment store. I don't know where I was. Leave me alone. And I'm backing up. I miss it. I see the pole. I didn't see the pole and I cranked into it. And then when I drove away, everything was still intact. I had a little bit of a dent, like I had a paint chip on my bumper, but I smashed that taillight, like smashed it, and it didn't break at all. And that's a stationary object.
And didn't that same person also do something with the lighting inside of the taillight, that it's not white? Like even if you break through the layers of the light, it's not white. It's red. Everything is red. So when they show you, right. So when they say it was white because it was broken, well, there's no white light inside of the
I'm sorry. OBOK. Did you become a YouTube member? A consensual YouTube member at the Nurse Kim house?
Oh my goodness.
Who are we?
What an honor.
The LED is red. That's right, Ashley.
Yeah, that was like pretty important. I thought that was shocking because there's times they try to say that the complete opposite.
There's no way a man's arm is going to break that. It's not.
Yeah, when it's used for cockpits, like it's literally used for cockpits, for airplanes to get high pressure, pounds of pressure resistance. And it was his arm that took it out. Okay. Just did it, guys. It makes sense. It just did. Thank you, Jen Altman. You're in the chat and that's fun. Meatball Morrissey, Sketty Stain. Hi. Why didn't the ME opine on lividity? That seemed odd to me. Livor mortis begins to set in within 20 to 30. Very peculiar.
Well, he did have some signs of livor mortis. If you look in his the pictures from the hospital, there were some people saying that, oh, he was kicked on the side and that's why he had bruising on the side, but it is really signs of livor mortis. which happens pretty quickly after death. But who knows if it was there? It wasn't there. Those pictures were taken after death, so that's probably what that was. That's
Somebody
why I
talked
think they
about it.
didn't mention it.
Remember who?
Well, then that would explain
And
why blood
catastrophe.
alcohol is still so high. You know, there's so many things.
Yeah, so many factors, right? Absolutely. Catastrophe. Kate, thank you so much. Lovey says, as a medic, we were taught you aren't dead till you're warm and dead, just so you know.
True.
Yes, that's so true, babe. That is like, I remember that in my nursing school too. PTSD healer says, Hank's been watching The Pit. LOL.
Oh, I love The Pit.
Oh, I've
What's
never
The
seen
Pit?
it.
If you liked ER, anybody in this panel or anyone anywhere,
It's a good
Obsessed.
show.
I'm not going
Oh.
to tell you who stars in it. They're from ER. It is on Max.
Ooh.
George?
One of the more
Is George
realistic
in it?
shows. One of the more realistic medical shows I've seen in a while. Love it. Obsessed with it. Watch it. Everyone watch it.
Okay,
They
I'm
talk
going
about
to put it
burr holes.
on.
Yeah, they talk about burr holes.
Yeah.
You can see some burr holes happening.
I love that. I used to love when I was like, I wasn't even a baby nurse, like, because Grey's Anatomy came out so long ago, babes, like so fucking long ago. I think I was still in high school. And I remember watching it and oh my gosh, you guys are going to drop dead. I just found my mother gave me my freaking yearbook, okay, from high school, my high school yearbook.
What year did
Tell
you
me
graduate?
why. I graduated in 04. Tell me why. My quote
Such a baby.
ended.
You're such a baby.
What did I put in my high school yearbook? What was I going to be when I grew up? Oh, let's just find out. She lived up to part of her goals. It said, this is my final sentence. I hope everyone is happy in the future, as I will be married to Tom Brady and being the nurse for the Patriots.
Oh, Kim,
Mwah.
I love you. So you're so Massachusetts. I love that.
There's a question here. I got to know, was his intubation confirmed adequate by chest x right? They wouldn't really do that after somebody dies. We can look at intubation by breath sounds and chest movement. But the photographer lady was intubated incorrectly. I think he probably was at first, which is why he vomited.
They said they by auscultation and
Yeah.
Yeah,
another
we
way.
don't. When you intubate, when you intubate someone, you take a chest X-ray, and you wouldn't take that after death to see if it was.
Right.
Kim,
We
put that back up.
They would go to the ME with everything, like the IO,
Right.
the ET tube, everything's still in
Right.
place. So that could be in the report of if it was in the right spot. But yeah, they would not take the time to do that. The chest X-ray, it wouldn't make sense.
Oh, I can't do it. It won't do it. I'm sorry. Oh, look at her.
Oh,
Look at her.
yeah, me.
I love that. Is that
Who
now?
did
Is
you
that your
think she
husband? Now?
was?
Look at those Bumbies.
Is that your husband now?
Yeah, is that Mr. Nurse Kim?
No, Mr. Nurse Kim. I didn't. I met him in 05. So,
Oh,
you know, 04, I was still living the dream. You know what I'm saying? Yeah. So, and love Romy with cheese. Thank you so much for gifting
She's
10
always
I love
non-consensual.
Romy. She's hilarious.
She's the best. She
She's
is
so
the
funny.
absolute best. She's out of her tits today. She's voice noting me. Don't worry, Rome. I'll text you
So
afterwards.
So funny.
And Midnight Mike and his famous full moon. Okay. I don't know about you girls, but it does something for me. And thank you, Midnight Mike, for gifting 5 non-consensual Nurse Kim memberships. Again, I don't know who I think I am. Babes, we'll take questions afterwards. I just want to do like if there's any cool, super good ones in the chat, babes, just ask them now. Holly Kramer. Could he have survived the brainstem injury though? No, babe. That's the concern, right?
That's
In
not very
my medical opinion, Officer John O'Keefe, all his autonomic nervous system shut down, his respiration shut down. He had brain death. Okay. He was never going to have a quality of life that would have resembled anything of what he lived before that blow to his cranium, in my opinion.
Yeah, he would have been vent dependent in a home.
Well, look at Frank. I know you. Will you think he would have with a herniated brainstem?
Hell no.
Okay.
No, God no.
Okay, just making sure. I just want, because you're ICU. I'm never. I
Brain
did.
death. You
I
have
did
brain death.
pre-op.
And at that
Mm,
point,
mm.
you're doing nothing for yourself. Absolutely nothing.
KR said she wiped snow off face. Why no frostbite? Robin G, and this is why you are the smartest and the prettiest. Thank you for being here, and I love your little doggy's ball. That is my friend. I love that you say that, right? But how long was he in it? How long, when, if she's wiping the snow from his face, how long? How long had he been there? There's no freaking possible way in my medical training and experience had I ever seen someone out in 18 to 22 degrees. Babe, I've had seen children come in with their cheeks have like early frostbite on their cheeks because they were just sledding with their mom and they're bundled to the friggin' hilt, okay? And then the mother goes, oh my gosh, I didn't cover right there, right? She's got a hood on, she's got the scarf, she's got the middies, she's got all the things, and the baby's cheek, this much is exposed, right? 45 minutes out in the cold, and the baby's got, the red, and they're like, oh geez, all right, just, just warm up and do what you're doing. Just be as protective as you can. But it does not make sense. It does not make sense. And if you want to really challenge yourself, go and don't do it if you can't handle it. If your belly is weak or you get a little queasy tummy, don't go to look at Officer John Okeefe's photos from, after he has passed away. Because if you see his face, right, and you look at those eyes and then, but try to look past that and look at his skin, look at his pallor, look his coloring, look at everything, and you will clear as day note that there is no frostbite of like extensives, like, a severe, is he at the beginning stages? Sure. Okay. He's got white tips. But other than that, no, it's not there. It never was.
How long are they saying that he was out in the snow is a question I have. I don't know. You guys
5.5 hours.
5.5 hours.
5.5
And 18 degrees.
His hands would have started to get black, like a leather glove.
Mhm.
Babe, watch this. Oops, sorry. I'm throwing up a.
There we go. See, there's the black.
Here we go.
There we go.
This is what I do.
That's good. That's good.
Nurse Kimming.
Yeah,
Nurse
and then,
Kimming has
what
a prop.
happens to that?
We have a layover or a layover, whatever. I don't know what it's called, but we go, okay, so stage 1, frost nip, cold, sore, painful, skin could be red or purple. That is where they were saying that they found, babes, when they were seeing the one part, when they looked at Officer John Okeefe's back, and they said he was bright red, babe. So
After
he was
that many hours, fuck off.
That's
this is a trip.
exactly, Frank. Stage 2, we're in the superficial frostbite, pins and needles, patches, peeling skin off. Look at that stage 3 deep frostbite, numbness, hard, black skin forms. That was nowhere located on Officer John Okeefe's body. Nowhere. Not the tip of his nose, not the tip of his toes, not his earlobes. Okay. There was no photos that would indicate or tell us, or his body told us that was occurring. That process was going on in his body. It didn't happen. Okay. Now I'm sorry. Oh, and then it's my sister. Look at my sister, Petty Paralegal, our mother, Mary Malarkey. We miss you today. Gifting 5 Nurse Kim non-consensual memberships. I will not be able to fit my head through a door. Megan Easton has been a member for 4 months. Megan, what is wrong with you? Megan, we're going to have to get you maybe a section 12. If you're hanging out with me for 4 months, oh, lovey. I love you and I appreciate you. And you are a gift. And, Frank only came here for you, Megan. It wasn't me.
Only you, Meg. I was like, is Meg?
That's what I heard.
Not, I'm fucking out.
Yeah.
Me too. Me too.
Oh, Kersey Nursey. Jeez, I thought you came for me. That's fine.
I did. Sorry, my bad. And Altman.
Yeah, for the Altman.
Jen Altman. I'm just a rando here. Okay, Mike B from the 413. What's up, Mikey B? 30 years as a medic. I have never seen a pedestrian crash with that much head trauma. Babe, ditto. Same Z's. That's where I was like, got the twitch in the eye. where there wasn't chest and or extremity injuries, let alone just a tail light and 47 pieces damage to the vehicle. Mike B from the 413, we're going to refer to you as our medic man from now on. Okay.
If you've ever intubated somebody that's been hit by a car with chest injuries, it's not easy to do at all.
I mean, not to bring up another case, but it's just like intubating Enrique. You would be healthy on somebody that is that young, but somebody that, you know, may have allegedly been beat up, that was not an easy intubation. Just if nobody knew that.
Right.
Yeah.
Yep.
Good point.
Heartbreaking with Enrique, still nothing there. And Sandra Mayhew, celebrating our 37th anniversary, watching you amazing loveys. Oh, you're the best. Hugs from Sandra and Randy in South Carolina.
Happy anniversary.
You guys are watching us. You should be falking.
Oh, we're falking. Sandra, you're going to be falking later?
Okay. Later.
You know what I'm saying? I love it. Listen, you and Randy, get Randy, you know? That is perfect. I'm obsessed. Now we have the petty paralegal. Oh, stop it. Now you're throwing dollar bills. Sister, what am I, Christmas present this year? Cut the shit. Petty paralegal, thank you so much. We need this weekly. Broads, I'm going to tell you this right now. If you are feeling froggy and you would like to bless me with your presence, I would love to do that. Like during trial, if we want to do a weekly weekly medical roundup, like you're my broads and I would love to hang out with you.
Will somebody send me like a what happened in the trial, like a quick rundown, and then I can, because I have no time.
I'll send you a daily. I'll
be watching the pit. I have no time to be watching this trial.
She's watching the pit. She's deep in the pit.
Deep in the pit.
Oh my God,
I'll text
I love you.
Daily.
Just bullet points.
3 paragraph thing.
Just the idiocy,
I love you.
And then
And Pinky Promises, thank you so much for becoming a consensual member tonight. You are everything. Mike B. Oh, our medic man's coming in hot tonight. I'm a humoral head. He's a humoral head interosseous fan personally. Oh, are you talking dirty to us, Mike B from the 413? Look at he likes to get a humoral head. Okay, I like it. And then we've got Mrs. Clutch coming in tonight. Are you clutching those pearls and clenching that butt? I love it. No tail light in wounds. No blood on tail light. There it is. We're going to start it with that. That is how Alan Jackson, because I heard that my guy, as a non-consensual intern for David Yannetti, I heard he is not providing the opening statement this year. Okay, this season. Rude. But
so it's AJ?
It's AJ, I heard. This, and I don't even know if I did hear that. I might have made that up, guys.
Ladies love this AJ person? Maybe? No? Okay.
We love AJ.
But I hear,
Alan Jackson, honey. He's an attorney, babe. He's an attorney.
I hear on the streets the ladies love him. I don't know what I'm talking about, though. So
listen, I love that tall drink of water, Mr. Yannetti. Okay, yeah, look at him like a bowl of spaghetti every day.
I like Sazitsky.
Slurp him up. All right.
Yeah. We're Balkan. No, just kidding. But that's how we started, right? Is instead of saying Karen Reed was framed, which that was the best, gave me chills, and I literally teleported. I think that if somebody starts with John O'Keefe wasn't struck by a vehicle, right? And then you go, there was no taillight in the wounds and no blood on the taillight.
Wow.
Case closed.
There it is. Dead.
There it is.
Yeah. Case dismissed. Oh, Lord, Miss Clutch, you got me good, babe. I'm sorry. Who showed up tonight? Larry Legend, my guy.
Yeah.
Laz here. And P.S. Altman, I heard you and fucking Jimmy in that space. We'll beef later. But just gave us a little bit of shit today. Copycats. Ooh, it feels personal. Okay, and Larry says, this is a panel, a wooden panel of feminine medical smarts that should put the fear of God into any man. That is what we do. might make an auntie flip level of beauty and intelligence. Oh,
Tell them,
Larry.
tell the people.
Preach.
What an angel. We do need a flip ahead. Flip ahead should be paneling us, okay? Like, you know, I don't.
Oh,
wanna
that
be
account is great. I follow that account. They're great. I don't know these
Flip's
people, but they're
awesome.
great.
Look at our beautiful Lauren. Look at all the strong and pretty ladies we know.
Lauren.
Hi, Lauren. Look at you, you little angel. And great panel, ladies. Listen, we were feeling froggy on a Monday night. And then we have She Rage Knits.
Oh, I love that name.
I love that.
Yeah.
If you're making
I love that
sweaters or scarves or potentially doilies, I love knitting and I love people that have rage. So I think you found your home, hon. Thank you for becoming a YouTube member. And then we've got Hank's gaslighting methodology. That feels real close to home. Okay. That feels very accurate.
What a beautiful
proud-
picture, too.
I know, she's gorgeous. That's gorgeous. Wait a minute. Are you on paper that is teaching children how to do cursive, or is that a mugshot?
That looks like a mugshot.
Cursive paper.
And I love the color of her hair.
Oh,
Yeah.
I love everything.
Of
I love
course.
if that is a mugshot, babe, let's make some merch
That's a
because
good
that's hot
mugshot,
shit.
Yeah.
The plow driver didn't see him at 3:30. The Forge Edge was parked there at 3:30. He was there 1.5 to 2 hours max. And Hank's gaslighting methodology that may or may not be a mugshot photo of a beautiful woman with gray hair.
Hmm.
You're right.
With a
You're
power
right.
look.
You're right.
Right.
You're right.
Mhm.
Definitely.
What else
right.
is there to say? Oh, and here's what happens. This is what happens. Mike gets a little bit wild. He gets on the midnight train to Georgia. He hits me with that full moon and he gifts what? Another 5 Nurse Kim non-consensual memberships. I feel this may be crossing a line, Mike. Okay. I can't contain myself. Obsessed. And we've got Furious Wendy. Wendy says only 3. Only 3 months. Have you been with me? Well,
A lot of months.
Furious Wendy,
Next
that's
month you'll be
longer than the
4.
first. Listen, that's longer than the first, 4 relationships of my adult life. So me and you really have something going here. And Megan Easton, Megan, you did this realistically for your Uncle Francis, and I know that. But I'm gonna take it. I'm gonna take it. Why? Because grifting ain't easy, Megan. Okay. I'm
What I
up here
hear.
with these beautiful women. They're upstaging me as usual with their knowledge and their, I don't know. They have also je ne sais quoi. Okay. And what is it? It's basically Frank's fault. She smells real good in real life.
I think I do. I do.
And then an image of bias. Clerk Jim Clown has been a member for 1 month consensually. Nurses for the jury, justice for all. I want to hit a little bit on that one because I want to say that if the accurate note or the accurate number from Ronnie, our juror who came, Mr. Bowties, our little lovey, when he said that the nurses held, like the nurse held the line, right? And she was like, no, I'm not wavering. I'm not doing it. This is where I say, get nurses, get your
healthcare.
paramedics, get your, I'm thinking more like get a mechanic, get a fucking guy named Tony from Ira Lexus Danvers, who I know. Okay. And said that the key cycles didn't happen. Think about people who use their brains and may not be like extra, like they might be too intellectual about it or believe the Commonwealth too much. No? Maybe plumbers.
I'm froze.
Yeah, I think you need educated people, but not like I don't know, not people who are in the medical field or people who are just regular blue collar who just have common sense that this couldn't have happened the way they say it's happening or did happen.
Because it feels like it almost gets too much. Like if you are able to say that, hey, this doesn't make sense. None of this makes sense to us, right? But if you get lost in the sauce with what the Commonwealth is trying to what if any you to death, or now with Hank Brennan trying to get the turtle boy, like if you're him going so fucking hard for like communications that are not actually like present in a phone between Karen and Turtle Boy, it says a lot to me. Pay attention to evidence, pay attention to your case, and not this bullshit, because it had nothing to do with Officer John O'Keefe's death. And yet you are still making a spectacle out of Norfolk Superior Court every time you get up, in my opinion.
So
If
I've
you
been
have no manner
watching.
of death, why do you want Turtle Boy's fucking text messages? Get a manner of death first. How about we do that? Just
Oh,
for
I've been-
shits and gigs, maybe. I don't know.
I've been watching the Ingolf Turk trial.
Me
which
too.
Is really, really interesting. And it's so amazing to watch. First of all, Kevin Reddington is a fucking prick. He is
He's
an
scary.
asshole. He is turning that jury off. He is making Katie look like the most terrible person, and it's going to backfire in his face. He's a dick. He's a dick to the judge. He's a dick to the witnesses. He's a dick to everyone. It started when he changed his profile picture to mine a year ago. I knew he was a fucking dick. He's a dick.
Oh.
But just the way, like, no,
Okay.
I think there've been 3 sidebars in like
Yeah.
3 days. Hardly any objections at all. Just the way this Judge Halal, is that his name? Judge Halal
Yeah.
runs the
I
courtroom.
haven't watched it.
It's so good. Melanie's been covering it, and it's been so
You know
good.
what else I loved about that is that, sorry, I'm losing my voice, that
Oh, Ruby.
they've been using chalks. I
Yeah.
feel like that would be so instrumental. And AJ,
We got the okay from Bev.
for the one though, right? Or is it for however many they want?
They
Wasn't
can
it-
use however many they want. The
Okay,
one, are you
good.
talking about the slide? Like, are you talking about the 141 slideshow? Or what were you talking
No.
about for the chalk?
No,
like,
so Kevin puts
signs.
up on he puts up on like a easel, like stuff.
Yeah, you
Showing
should.
your
We
picture.
got the okay from Bev to do that.
And for all of us, especially me, who does not know what chalks means, anyone?
A big
They're-
poster.
Big posters.
Visual aids.
Pictures.
There
Why don't
you
you just
go.
call it a
Pictures of
poster?
posters.
Why
She
do we
didn't
have to-
allow them last
Why do we have to
trial.
do new
Show
words?
and tell. She did. Well, she allowed them this time, so maybe that'll be something that is helpful for both sides, because you
Yeah,
know
it was too much talking the last trial.
it was so
I
much
mean,
talking.
It was too much talking. It was too much. I mean, I think they got to day like 23, and Lally had never even explained how he thinks John was killed.
Yeah.
I mean,
Oh
could
my
you imagine going into this and not knowing anything? And he's talking about, 30
The weather.
witnesses that are talking about the weather, right? And what band was playing and what they had to eat and their
Youth
White
soccer,
Claws.
youth sports. Yep, we touched a lot, but not anything that made sense. I got to know. Thank you so much for being a member for a month, and says absolutely love the medical factually info. Yes, love. Thank you so much for being here. And Annie from SB says, I enjoy coming here. This South Boston girl loves Nurse Kim.
Mhm.
Hey Annie from South Boston. Do you know Kevin?
Oh,
Do you
no.
know
Wrong. You wrong.
Do you know him? Because we could figure out and see what he's up to, what bars he frequents, okay? And maybe you could be his new girlfriend if you're into that. If you're not, I totally get it. But we need eyes on that man, that Kevin.
Kevin from South Boston.
He's wicked funny in chats. OBOK, stop it. So many hot STEM babies in one place. My favorite goyles. We're here, babe, and you are also a hot STEM babe. And if you
yeah,
ever
have you
want to
seen
STEM
yourself?
with me,
Yeah.
you want to stim with me and STEM with me, we can do all the things, babe, because we're a little bit ADHD. I go on a lot of paths, but if you can follow it, I might be the place.
She knows the path. I'll tell you that.
She And Meatball Morrissey Sadie Sane says, I have the twit. Wait, I have
Twit twat.
twit twat. Okay. But I don't understand it. I can't reply to trolls. Can someone explain why they keep saying embedded taillight in J.O.'s sweatshirt? Take it away.
Can we
Kirsty Nurse?
explain
So-
anything they say?
Sweatshirts are made with, and somebody did something the other day where I heard that sweatshirts themselves have some sort of fiberglass in them or something
Oh.
that's
Mm.
that like was it really taillight or was it just something that the sweatshirt was made of? And how does it become embedded in a sweatshirt?
Well, it wasn't.
Small little,
They
yeah.
just made that
It
up.
makes no sense. Yeah,
It
makes no
wasn't at all,
sense.
babe. It wasn't at all, honey. What it was scrapings from the orange shirt, two shirts, okay? Orange shirt and his hoodie.
Yeah.
And it was consistent with plastic. Okay, thank you. And nothing was embedded, babe. It went all into an envelope, and you have no idea if it came from the orange shirt, if it came from the outer shirt, if it
Right.
came from the floor after being in a pile on an
Proctor's
ambulance
car.
or a hospital floor.
Right.
Just saying. And then we've got Marie is clenching my pearls and my butt. Oh, love all of you fabulous ladies. Thank you so much, Marie, for being here, clutching and clenching all together. And Blair says the only meeting I'll ever attend when I'm clocked out. I told my patient to clutch her pearls today for her IV, and she said, "You took my jewelry."
Cute.
Cute.
She's cute too. All the super chatters are
I
cute.
know all these ladies are
What
pretty.
the heck?
Oh my gosh, I
Yeah.
love that. Blair, are you send me an email if you can, Lovey, because I love that you always say that you like the meeting. She goes, "I'll be there," and you're the only one I'll come to when I'm not on the clock. So I love that. And maybe we could have you on the beautiful panels. Oh, Hank's gaslighting methodology. Hello again. The photo is from who? Westertech
West.
commercial. Google it. It's a mugshot. Hilarious. 2:30 a.m. was the first time plow went by and saw no body.
Lucky.
Amazing. I'm going to look up the Westertech.
That amazes me that Ronnie said that they didn't take Lucky's testimony seriously. I thought he was just the best.
Yeah.
I thought
Agree.
that was powerful.
Yeah, well, but they got confused, right? Because they said that he didn't report the basketball hoop, but he did. And it's
Yeah.
like, babe, you're trusting people on that late in the game, like
It's too much.
to be taking the notes. Like you aren't able to have read back. You aren't able to, just the Commonwealth really is chilling in 1778. You know what I'm saying?
Yeah.
Like, can we try to bop into the 21st century anytime, anytime now. And Annie from South Boston says this Southie girl is 65. So F no, fuck no. All right. To that Kevin from South Boston. And I hear you. The men aren't worth the trouble. I'm 39 and I too, if Mr. Nurse Kim makes one fucking more wrong move, we might end up on an ID show. You know what I'm saying? So, this has been a night. You are all the smartest, the prettiest. It is 9:49 p.m. I want to say, I guess, what pit we're doing. Let's listen to this. Why on earth do they have to go on memory? I don't know, Gazzo, because that would be the fuckery that we live within, right? The Commonwealth just decides to bust balls on the reg, and yeah, they just hate us. Oh,
Nurse Kim, you used to watch Parks and Rec, right?
Oh, yeah.
That's what the pit keeps reminding me of when he's like,
It's not like
"Apparently
that
to
pit,
the
but
pit."
it's still good.
Remember?
I do. And Frank goes, "It's not like that pit."
It's still good, but it's not like that one.
Not that pit.
No, but you'll
I
still
love
like
that.
it.
Mary Flynn loves Lucky. And we've got Kate. Hi, Kate. Right. The trial was streamed. Just show them the video, right? Like, I mean, for the love. Poor everybody. Yep.
Can they show them this video? I mean, for fuck's sake.
Yeah.
Just show them this, all of us.
Yes.
J. Edgar Hoogan. We all fell into the pit. Yes. Oh, and then we got just one more question, babes. We'll do this one, and then we will say goodnight to our best friends from out of town. But Mrs. Smith asked at Nurse Kim, AKA all of us. A few months ago, I think Hank said John could have survived if he received treatment sooner. Oh, this was our burhole conversation. Curious, his prognosis if he received treatment at 2:27 a.m. In my opinion, Jen should have been added to third party. Well, and again, we don't know specifically what time, but that Officer John O'Keefe was actually, whatever happened to him, that happened to him, other than he was not struck by a vehicle at 12:32 a.m. on January 29th, 2022. Period. That's all I know, babe. But that's an interesting point that is very interesting that the defense never went for Jen, because no matter what the Celebrate report or Whiffen or Hyde, right? They have a Celebrate report that says that she made a fucking 227 Google search of House Long to Die in Cold. That's not made up by the defense.
No.
That was a report that was generated. And whether or not, clearly I don't think that Jen hurt, Officer John O'Keefe physically, but that is a very, very suspect. And, if that Google search was in Karen's phone, Karen would have had to take a plea. So how is it that it's in Jen's phone and it doesn't matter at all to anyone, apparently, on the Commonwealth side?
That's what got me, the first one. That's what got me.
Yes.
And then what's his name? Matt Phelps used that against me in the podcast to go into how stupid we all are for thinking that actually existed.
Yes. Oh, and then this is also very true as well. And then deleted it. And I do want to remind you guys all one thing. There has never been a time in my life, okay, that I've gone to a patient's home that they have been, even people that had their obituaries that unfortunately that they did pass away when I was visiting nursing and all that jazz. Never have I ever Googled myself a day after my friend died.
I've never Googled myself in my life. Never mind that. For what?
That's weird. Yeah. That's weird. And it was put up on the screen. And I'm like, why is nobody talking about that? Why in the fuck is she looking up Officer John O'Keefe obituary and then looking up Jennifer McCabe? Huh.
I think the deleting of that only thing she ever deleted on her phone.
Right.
Was that any search she's ever
Ernie.
deleted. I think that's huge. They have to bring it up at this trial. I mean,
thanks for all the opinions.
What I'm here for. Just giving opinions and shit.
I love it. All right, babes, you are the best. You are the smartest. You are the prettiest that ever lived. Thank you for being here tonight with me.
Thanks
to my Altman, my Francis Marion, first of your name, and to the first time on a YouTube stream, in my opinion. I think, am I right on that, Kirsty Nursey M?
Yep.
You are a superstar. I would love to be honored to have you back anytime. And thank you for always being the best freaking mod that ever lived. You are my babe.
My all.
Excuse me. I'm a mod too. Don't say that.
Listen, Jen Altman, when you're in the chat, that's fun. Okay. You know what I mean? But you can't top that, Kirsty.
She is the best. She is the best.
And Miss Jess NB and my Mimi. Are you kidding me? My Mimi's been with me since freaking she was my first. Oh my God, I love a Romy with cheese. Yes. Everyone, listen, anyone who is a mod, you basically,
you're all so great.
I would take care of. Okay. If you need anything from me, you can have nursing services. I can also send you an edible arrangement. Okay. I love you. I love all your faces. Tomorrow we start 2.0. Mwah. Night, babes.
Good night.
Bye, guys. Love you all.